don't we feel uncomfortable when we see private parts of the male patients?
Just think about where your hand have been in life.
Uh,
Think about it, guys. If you can remember, just think about it.
mm.
I'm the kind of person that I don't want to say I'm nonchalant here, but I believe that
You are 50%.
okay, I believe that what must be must be.
Yeah, yeah, yeah.
I believe in duty. I believe that there are some things that we should do.
What will happen? What
What will
happen?
happen? Is it whatever?
Oh, I'm afraid of blood. This and that. I think that's if you face your fears. I think that's that perception of, oh, this smells bad, oh, this doesn't look good, oh, this is disgusting. I think it will be removed from your mind. She's very, very afraid of blood, so she thought, oh no, I can do it, I can survive it. But when she tried it herself and she did something wrong, that's why there was blood coming out, because supposedly blood should not come out there. So the blood came out. She was very, very terrified. She was in panic. She wanted to go home. She stained her uniform with blood.
Hello, guys. This is Promise, the host of Simply Promise and You. You're welcome to my YouTube channel. Please make sure you like, share, and subscribe. If you have any opinions, ensure to drop them in the comment section. It promises to be informative, educative, and entertaining. Welcome, guys.
Hello guys, welcome back to Simply Promise and You. So welcome back to our video. If you haven't subscribed yet, please consider subscribing and like her videos and share it to your family and friends. So now I am your usual and one and only co-host, of course. I am Mariam, and beside me is a very
Handsome,
handsome.
masculine.
This beside me is the host of the original host of this show,
And they call him Mr. International of LNU.
and Mr. Global Africa. So, what are we going to talk about?
So, you guys are aware we are student nurses and we are we are in our last semester. We're almost done. Almost done, then we are done. And as student nurses, we experience varieties of things, and some of the settings of that usually happens in the hospital.
In the hospital, yeah.
And at the hospital, we see many things. We get to witness blood,
Yes.
witness human excreta,
Things that
Things
normal
that
people
will
don't
do-
get to see.
People laugh. So now people might be like asking,
Mm,
after seeing all these things,
mm.
how do you guys manage to eat
Yes.
and not not be like turned off after seeing all those things?
Mhm.
So we just share our thoughts. What we think
Okay.
about it.
For me, let's start with me. I think that the first encounter that I had with such things is not in the hospital itself. You know, we had these health assessments or fundamentals of nursing. Um, we do injections. So for my own, when I was second year or first year, I don't know. Um, we started to learn about injections, different angle of injections, and there was one of my classmates. She's very, very afraid of blood, so she thought, oh no, I can do it, I can survive it. But when she tried it herself and she did something wrong, that's why there was blood coming out, because supposedly blood should not come out there. So the blood came out. She was very, very terrified. She was in panic. She wanted to go home. She stained her uniform with blood. She soaked with blood here on her shoulders. Now, but for me, I don't think I had those kind of experiences personally with myself, because I'm not really afraid of blood. When it comes to hospital, this is what my parents specifically or my family members ask me. After those operations, after those like deliveries, like cesarean sections, how do I manage to eat? So for me, I think at first my problem was the scent.
The scent of the
I
blood.
don't have a problem with the how I see it. I don't have a problem with it, but with the things that I smell, that's when I was getting turned off, especially in the delivery area, because that's the first area that we're exposed to after our capping and pinning. So when I first got my case in the delivery room area. You know what we call lokia.
Lock-in.
The lokia is the blood that comes out whenever the mother is giving birth.
Okay, the red.
So
Okay.
that kind of thing has a specific scent. It's not the normal scent of a blood.
Okay.
You know what I mean? It has a specific scent in which is a little bit fishy that I don't understand what is it. At first, I was very uncomfortable with it, but then after that first case, I feel like I became more comfortable with it.
Mhm.
After that first case, I was like, I'm getting to, I'm getting to I'm getting used to it. That after the cesarean section, after the major operations, I can just eat. Like
Okay.
nothing else. I think that I can also explain it exactly how, but I think that um, when you're always in it, then you get used to it. Even though you tell me, "Oh, I'm afraid of blood," this and that. I think that's if you face your fears. I think that's that perception of, oh, this smells bad, oh, this doesn't look good, oh, this is disgusting. I think it will be removed from your mind. I guess that's it.
Yeah, I think for me personally, one of the things that really so one of my coping mechanisms when it comes to things like that is kind of the mindset I have. I'm the kind of person that I don't want to say I'm nonchalant here, but I believe that
You are 50%.
okay, I believe that what must be must be.
Yeah, yeah, yeah.
I believe in duty. I believe that there are some things that we should do.
What will happen? What
What will
happen?
happen? Is it whatever, whatever. So what will happen will happen. I believe that when I perform my responsibility, yeah, in the act of performing my responsibilities, I understand that there are certain things that will happen,
Yes.
and there are certain things that might be awful, or might be even be uneventful. So, what do I do to avert the possibility of me feeling turned off by it? Is by reminding myself that some things are normal.
Yes.
Do you get it? So when I go to the hospital, I'll be like, yeah, I just get but the reason why I'm here, let me just get it done and just go home. And I think another thing that really helps me to not really be thrown aback is the fact that when I remember what I myself think about this,
Yeah,
what you
yeah,
do on your
yeah,
own,
yeah.
the kind of things that your hand also touches.
Yes.
Just think about where your hand have been in life.
Uh,
Think about it, guys. If you can remember, just think about it. The things that you have touched that are so unhygienic.
yes.
So if I can remember all the things that I have touched that are so unhygienic and I still eat, so why would I deny myself of food?
And we're sterile inside the
Yes,
operating. We're
yes, and we're
sterile.
stereo, yeah.
Everything is sterilized. We are covered, of
Mm-hmm.
course. I think that perception is very is perception plays a big role with it. Um, Also, there's another question that some people ask me.
Hey, what is
I want to
it?
ask you now. Don't we feel uncomfortable when we see private parts of the male patients?
Mm.
I think that for me, it's very professional. I don't know how about the mindset of other people, but for me, it's very professional. If I see someone that is like, for example, if someone has a clinical procedure that requires us to clean or see the private part of try not to laugh. The private part of the male patient. I think that um, teaching us about the patient's privacy and confidentiality in our university plays a big role in it because there we learn ethical principles, and I think that is why bioethics or ethics, bio means life, right? And ethics, you know what I mean by that. So I think bioethics plays a big role in nursing school because these things can play a big part on how we act in the clinic or in the hospital or in the operation room when we already have to do some things like that. So I think for me it's very normal. And for some people, of course, especially here in the Philippines, there are still many conservatives who is like, you see it like
Yes,
every
I
day.
saw it.
Yeah.
I
Was
saw
like,
it.
yes, and
What
so
will you do about it?
It's part of healthcare. How can I work in healthcare if I'm
Yes,
not comfortable with it? That doesn't mean that
I saw it.
But you know what? Part of it is like, thinking that, oh, I should be professional with it. Even if sometimes you get shocked with some things, I think that you should also control yourself on the reactions because it might send a wrong signal, especially to the patient. The first thing that we have to ensure is for the patient to be comfortable. We have to establish rapport. Just like what we're always studying, establish trust with the patient. So I think that as a student nurse, um, from now on, you should learn how to like control your reactions to things and just stay professional because it will affect also how the patient perceive you as a healthcare provider.
Yeah, so that's it. For me, I'm cool. I
Very cool.
understand. I'm very, very cool. I'm used to it. As long as I
Yeah.
don't make the patient feel rattled out, make them
Yeah.
feel like I'm being creepy with
Yes,
them. Just
yes.
make them feel
Yeah,
cool.
especially male students.
Yeah, and sometimes I think it usually depends on how you look at them.
Yes,
Don't give
that's
them
what
the,
I'm
don't give them.
saying.
In fact, I don't necessarily look into their eyes. I just look at them.
Do what you have
Do
to
not,
do.
if I
Yeah.
want to look at them, I just say what I have to say. Go back.
Yeah, yeah,
So
yeah.
that's
And
it.
especially let me just say this to the male student nurses. You can also ask your clinical instructor if you have to do it yourself because there are some patients also, especially in the delivery area, where women, they had miscarriages sadly. So you have to do the DNC or dilatation and curettage. That's what we do to remove all of the things that was there. So there will be no infection or there will be no sepsis that will happen to the mother. So imagine the grief that the patient is going through, and then she will say, "Oh," and she will know that you're a student nurse, you're not a professional nurse yet. So the thing is, for me, I suggest that you ask your clinical instructor with it. If the patient is okay with, if you cannot talk directly to the patient because the patient is, having this physical pain and grief, emotional things. If you cannot talk to the patient directly, talk to your clinical instructor. There's nothing wrong with it.
Yeah, so maybe the next video we're gonna do, maybe we'll have to invite Daniela or someone else. We'll
Yes.
talk about this is the topic I was also what I was discussing we had earlier today.
Things that you
That
don't know.
why is it that after seeing the opposite sex, like
Private
the
parts.
private parts of the opposite sex, we still have people that are still being babaero or lacaero,
Yeah.
despite being used to those kind of things. So we invite
Some of them.
Daniela and maybe some other students to talk about it.
Yes.
So just let us know what you think about this. So as a student nurse, how do you feel? How do you cope after seeing blood and other excreta and still find a way to eat?
Yes. Yes.
So make sure you like, you share,
Subscribe.
and subscribe. So goodbye, guys.